Good afternoon, everyone, and thank you for joining us today, this January the 4th, 2022. I'd like to welcome today Jason Thorne, our Emergency Operations Center Director, Dr. Elizabeth Richardson, our Medical Officer of Health, Melissa Farrell, President of St. Joseph's Healthcare Hamilton, Rob MacIsaac, President and CEO of Hamilton Health Sciences, and Dr. Scott Wooder, Lead Physician, Hamilton Family Health Team. As you know, yesterday, the Premier, alongside our Ontario's Chief Medical Officer of Health, announced new and necessary public health measures to reduce the spread of COVID-19 and the highly transmissible Omicron variant. With that, we have some of our key healthcare partners here today who have been on the front lines of our response to ensure that there is a broad public understanding of the issues we're facing and how we can all best help manage the evolution of this virus. This is a significant collective community response that we've undertaken here with significant impacts on our local healthcare system. And I know people are tired and frustrated, maybe even fearful or angry about where we find ourselves right now, but I ask everyone to be as patient and kind with one another as you can be and follow all of the public health measures in place, including getting vaccinated. We know that vaccination continues to be critical to the fight against COVID-19. And I do want to express my deep gratitude and thanks to the healthcare workers and many across the system that have shifted with us to make the necessary changes in order to increase vaccination capacity wherever possible. We're committed to getting as many COVID-19 vaccines into as many arms as possible, and we have mobilized additional human resources to support vaccine clinics in our city. Everything we're doing is to protect residents and push back on this virus. And while I know yesterday's announcement was not the news we wanted to hear in this new year at this time, these measures are necessary. It is instrumental for everyone to continue to follow public health guidelines to reduce the spread of COVID-19 and the variants in our community. We are hearing that charges around not masking in public spaces where required are increasing. So just a reminder to please mask if you're someone who's able to whenever you're in a public space where masking is required. This is an important line of defense in our fight against COVID-19. And from a vaccine perspective, another critical measure to fighting the vaccine is vaccinations. Appointments are required for individuals who are eligible for third or booster doses, those 18 plus. And community members can learn about available locations, hours of operations, and how to book at hamilton.ca/get-your-vaccine. And I know that Dr. Richardson will have some interesting updates on this as well coming up. But first, I'm going to turn it over to Jason Thorne, our Emergency Operations Center Director, for some updates on how these changes will impact city services. Jason?
Thank you very much, Mr. Mayor. And as the Mayor noted, the province announced yesterday that we are moving back into step 2 of the roadmap to reopen to help slow the spread of the Omicron variant. And that means there are a number of new measures that will come into force and effect as of midnight tonight. And I will provide some of the major ones that the public should be aware of. The social gatherings will be reduced to a limit of 5 people indoors and 10 people outdoors. Organized public events will be limited to 5 people indoors. Businesses and organizations are required to ensure that employees work remotely unless the nature of their work requires them to be on site. Capacity limits are in place for indoor weddings, funerals, religious services to 50% capacity. Retail settings such as shopping malls are also permitted at 50% capacity. As are personal care services at 50% capacity. Indoor meeting and event spaces are closed with some limited exceptions, but outdoor spaces are permitted to reopen with some restrictions in place. Public libraries are limited to 50% capacity. Indoor dining at restaurants, bars, other food or drink establishments are closed. Outdoor dining with restrictions is able to continue, as is takeout, drive-throughs, and delivery at our local restaurants. The sale of alcohol is restricted after 10 p.m. and the consumption of alcohol on premises in businesses or settings after 11 p.m. With delivery and takeout, grocery convenience stores, and other liquor stores exempted. Indoor concert venues, theaters, cinemas are closed, as are museums, galleries, historic sites, and similar types of attractions. Outdoor establishments are permitted to open with restrictions and with spectator occupancy, where applicable, limited to 50% capacity. Finally, indoor sports and recreational fitness facilities, including gyms, are required to close with the exception of those for athletes training for the Olympics or Paralympics and some select professional and elite amateur sport leagues. These measures, as I said, will come into force at midnight tonight, and the province has indicated they'll be in place for at least 21 days. So that is up to January the 26th. As has been widely reported, all publicly funded and private schools will move to remote learning starting Wednesday, January 5th until at least Monday, January the 17th, again, subject to public health trends and operational considerations. School buildings are permitted to open for childcare operations, including emergency childcare, and to provide instruction for in-person instruction for students with special education needs who cannot be accommodated remotely, or for staff who are unable to deliver instruction from home. As schools are closed for in-person learning, the Ministry of Education and the city are providing targeted free emergency childcare for school-aged children of designated essential frontline healthcare workers. That is effective immediately. Emergency childcare is available for designated essential workers as defined by provincial eligibility requirements who are not able to accommodate their school-aged children, their learning or their care at home. Emergency childcare in Hamilton is being provided by the 3 licensed home childcare agencies, Today's Family, We Watch Galbraith, and We Watch Gulfwood, and the list of eligible frontline healthcare workers is available on the city's website. As the mayor noted, there are some impacts to some city services as well. Just prior to the holidays, we had shared that all of our recreation centers would be closing and that all indoor programming would be canceled, but that arenas would be remaining open. With the provincial announcements yesterday, we are now closing arenas as well. And in keeping with provincial regulations, there will still be some allowance for Olympics athletes and Paralympic athletes who do train in some of our arenas. Outdoor rinks will remain open and will be available for use on a first come, first served basis. They are required to have a 50% capacity limit. And as I mentioned earlier, libraries as well are restricted to a 50% capacity limit, but all branches will remain open with some modified hours as we have redeployed some of our library staff to assist with the city's vaccination effort. And finally, we continue to work closely with Hamilton Public Health Services and healthcare partners across the community to support and scale up the COVID-19 response across the city. We're doing everything we can to help staff the various clinics and ensure that we can scale up the number of COVID-19 doses that are available each day. So that means that we have redeployed and continue to redeploy a number of our city staff to support that effort. Currently, we have about 250 city staff who have been redeployed to support, and we are looking at identifying some additional staff in the coming days. We are also therefore planning on some staff shortages, both due to those redeployments and also due to the impacts that staff isolation and quarantine may have, as well as staff illnesses. Currently, we have 352 city employees who've either tested positive for COVID-19 or are in isolation as of today. So senior staff are reviewing all of our business continuity plans for our various service areas to prepare to make sure that we're able to make service adjustments if it becomes necessary due to those staff shortages. So with that, I will turn things over to Dr. Richardson.
Thanks very much, Jason. So do want to just dive into the numbers a little bit, but as you know from hearing from our Provincial Chief MOH, Dr. Kieran Moore, and is reflected in the changes that you've just heard from Jason, the situation, of course, in Hamilton and across Ontario with regards to COVID-19 is very concerning. Our 7-day moving average at this point is 708 cases reported per day, and the weekly incidence per 100,000 is sitting at 827, with our most recently updated weekly reproductive number sitting at 1.84. I do want to highlight, though, of course, that our COVID-19 case numbers are very much underestimated. With the rapid spread of Omicron and our reduced access to testing, we are, of course, just reporting on the tip of the iceberg when it comes to the number of cases that are here in Hamilton. So as we go forward, we're going to start predominantly focusing on the key health indicators that we're tracking at this point in the pandemic, which of course are our hospitalizations and ICU admissions, and as well deaths. And when school resumes, they'll be reporting of absenteeism in schools as well. To that end, our average number of daily new hospitalizations has been going up. There are approximately 4 new hospital admissions each day on average. The average number of deaths at this point, though, also it does remain low. We're anticipating that our local percent positivity data from ISIS is going to be similar to that from Ontario, which is sitting at a rate of about 30% of those tests that are able to be done, the PCR tests that are able to be done. Currently, we have 51 active outbreaks, with 8 new outbreaks being reported today and no outbreaks having been declared over. These outbreaks are largely in health settings. As you know, we're now focusing on the outbreaks that are happening in those settings, so we'll only be reporting on those ones. And those, of course, include long-term care homes, retirement homes, group homes, shelters, hospitals. All of those will continue to be reported on, and you can find all the details on those on our dashboard. I know many Hamiltonians are very much disappointed and discouraged by the fact that we're seeing such a surge in terms of spread with this Omicron variant, and of course the public health measures that we need to take in order to slow down transmission, to reduce the number of contacts that people are having, so that we can protect our health system for all of us, for those of us who may have COVID and have a more severe case, although it does look like it's about half as likely to cause that as previous variants were. It still is, particularly with the rapidity of spread, causing significant pressure on our healthcare system. And of course, our healthcare workers are very much under strain as we go forward. Local businesses and of course all of our workers who are working them are very anxious and exhausted too about the pandemic and its impact on our livelihoods and the sacrifices that people have had to make now for nearly 2 years. The measures that were put in place and announced by the Premier yesterday are necessary and proportionate to the threat that we have before us, and the priority to protect that health system capacity for all of us. We have also had, of course, the revisions in our case and contact management guidance. And as I said earlier, we're focusing in on high-risk settings, hospitals, long-term care homes, retirement homes, to do our case and contact management and our outbreak management. And so any individual who is sick during these periods of time is not going to be able to get testing at this point, needing to focus our testing resources. And I think Melissa's going to speak more to that piece, but also to be undertaking self-management when it comes to looking after the situation, making sure you stay home if you are sick, making sure you let contacts know that they are contacts of a case, and then they too, if their household members, can stay home for the period of time the index case is sick, or that if they become sick, and as well letting others know so that if they do work in a high-risk setting, they're able to take appropriate measures as well. As always, you can find all the guidance on how to manage COVID at the hamilton.ca/COVID page. And so if you think you've been exposed to COVID and want to access information, you can look to that page and work through what it is you need to do to protect yourself and your contacts. On the vaccination front, you know, we passed the 1 million mark just before December 25th, right at the 1-year anniversary of the vaccination program. And today we sit at about 84.7% of those born in 2016 or earlier having received a vaccine to date, and about 79.6% fully vaccinated. We've also now administered 164,000 third doses here in Hamilton, and have about another 260,000 people who are eligible for those third dose boosters as of today. Very important for those who have not yet had a first or second dose to come forward. Of course, they're welcome to walk into any one of our clinics, and we'll make sure that they receive their first or second dose. With booster doses, we are happy to say that our accessibility is opening up, but very much want people to come in and access those vaccines. We had about 20,000 appointments available for people at the beginning of today that spanned out over the next 2 weeks. And so in order to increase access for people, particularly those who are at higher risk of severe outcomes, starting tomorrow, January 5th, those 50 years of age and over who qualify for a third dose can walk into the Center on Barton COVID-19 vaccine clinic. So we are opening up that one clinic where we have the greatest capacity to help with walk-ins. And so if you're over 50 years of age, you can walk into that clinic starting tomorrow. The hours of operation are from 8 a.m. to 8:30 p.m. Parking around the area is free. And so we would be happy to see people taking us up on that availability. Right now, we're sitting at about 36% of the eligible population having had their third dose, and we are looking with the scale up that is happening both with the primary care partners, public health, hospital clinics that are running. We should be able to meet the demand for anybody who wants a third dose to have one by the end of this month. You'll know that as well, there was an announcement about people who live in long-term care homes, retirement homes, and other congregate settings for seniors being now eligible for a fourth dose of vaccine. So our partnership table is working hard to look at how we can help the retirement homes, long-term care homes in ensuring that people are able to get vaccinated with their fourth dose in that setting. And as well, of course, very important that the staff who are working in those settings can come forward either into the existing clinics, or we'll be working with them through those fourth dose clinics as well. It's critical as well that those who are aged 5 to 11 get fully vaccinated against COVID-19 to protect themselves and their family and loved ones in the community. Currently, we're sitting at 38% of children 5 to 11 years of age having received a first dose. We've had a significant amount of accessibility at open appointments over the last several weeks for children in that age group. So very much encouraging people to come forward. We continue to have access to those appointments. They are booked appointments because seeing little ones is a little bit more tricky in terms of making sure we have space and time for children to go through the clinic, but there is ample access. And so booking online is the best route to go, and you can get in quite quickly. So just a reminder as I wrap up that with the measures that the province has introduced, this is an important time in terms of reducing our access to very many sites in order to reduce our contacts overall and prevent the spread of Omicron, to protect those who are vulnerable. And each of us really plays a key role in doing that. So making sure to follow that guidance, to make sure to wear a mask properly, covering everywhere from the nose down through the chin. Making sure to stay home if we're sick, making sure to limit the size of social gatherings, but get outdoors. Do the things that you need to do to stay well physically, mentally. That is very important at the same time. It's a very difficult time in our community. The concerns of students, parents, and educators, of course, are top of mind as we go through this, and there's a shift to remote learning for the next 2 weeks. I do want to extend thanks to all Hamiltonians, healthcare workers, our partners from across all the different sectors in the fights to the efforts to fight COVID-19 and the Omicron variant. With that, I'm going to turn it over to Melissa Farrell, our president of St. Joseph's Healthcare Hamilton. Melissa.
Thank you so much, Dr. Richardson. So just a few highlights that I wanted to share from the St. Joe's perspective today. I wanted to share that we currently have 223 staff that are self-isolating at home for COVID-19. So that would be staff that have either tested positive for COVID or those that are high-risk exposures that would be at home. That represents about 3% of our workforce at this point in time. And I would say that we're managing with that percentage, but it's really tough on the teams. And to be completely clear, that has been rapidly increasing really every day. We're seeing the exponential growth that everyone's been talking about. So just 5 days ago on December 31st, it was 143. On December 22nd, it was 28. And the week before that, we had none. So it is just rapidly increasing. And really the rapid rise in the staff cases is a clear indicator just how quickly the Omicron variant is spreading. It's prevalent in our community, and it's obviously prevalent amongst our healthcare workers. I did also want to share that our COVID patient numbers are also rising. We're sitting right now with 74 active COVID patients at St. Joe's. On December 31st, it was 56 positive patients, 10 on December 22nd. And in the ICU, we currently have 10 active COVID patients. And December 31st, again, just last week, it was 6. And December 22nd, we had 3. So just we're seeing the exponential growth that everyone's been talking about. We are working to decipher between those whose primary reason for admission is COVID versus those who are admitted for other reasons, but also have COVID. But for our healthcare workers, it means the same thing. It requires an enhanced level of personal protective equipment. It requires the same, and the requirements around care remain the same. So again, this just is really highlighting that exponential growth that Dr. Moore has been talking about, that Dr. Richardson has been talking about, and everyone's been speaking about at the provincial level. I would also say that we're managing 6 outbreaks at St. Joe's, and that's the highest number of outbreaks we've had through the entire pandemic that we've been managing at one single point of time. So as you can appreciate, there was some guidance that came out through the province yesterday, and certainly we've been having the conversations at the provincial and regional level about surgical ramp down of services. We're still working through the details of what that ramp down is going to be looking like, but as you can appreciate, we will ensure and be doing everything we possibly can to continue with our urgent and emergent care. We do have well-established processes in place to really prioritize cases that can be delayed, but we know that this will be very hard for people who have been waiting to access care that will likely get bumped as a result of what's going on. I did just want to thank the community for helping us to slow the spread. If you can please continue to follow the public health measures, the masking and the gathering restrictions. You know, we really are in full support of what the province came out with yesterday. We need these restrictions in order to help protect our healthcare system at this point in time. And I did want to just also highlight and really just thank the staff and physicians. And I know Rob will do the same. And thank you for Dr. Richardson for also doing the same too. And the mayor. Just want to thank the staff and physicians for the relentless work that they have been doing. That's across all of the healthcare system, including the hospitals. This has been a prolonged pandemic for everyone, and they just remain so committed to patient care and keeping our Hamilton community safe. Just thank you for the commitment and the sacrifices that you've been making. I did want to make sure that we highlighted some of the changes that have been happening on the testing front that Dr. Richardson was just flagging. You know, at the provincial government announced late last week that there's changes to testing, and we're prioritizing different individuals for testing at this point of time. So really focusing on those at risk, which indicates anyone living with kidney disease, transplant recipients, cancer treatment, or 50 and over with risk factors, and our First Nations, Inuit or Métis, as well as those who are homeless or underhoused. In addition, if you have symptoms and are a patient-facing healthcare worker or a worker, essential caregiver, or resident of a congregate setting or hospital, you can get access to testing. So really critical, I think, that these changes have been made on the testing front, but we would also just say for those who have mild symptoms, you know, if you're sick, consider if it's something you can manage by resting at home. Is this something that you can be cared for by your family physician? I know Dr. Wooder will speak to that as well. Could you use virtual emergency department? You know, are there alternatives to going into the emerge? We're really trying to protect the emergency care for emergency services in particular. And we would really ask that people not come to emerge to try to get access to a PCR COVID test at this point in time. So those are the main points that I wanted to raise, and I just wanted to turn it over to Rob.
Yeah, thanks very much, Melissa, and good afternoon, everybody. So just a quick update from Hamilton Health Sciences. I would say as of today, we are very much holding our own, but there's no doubt this is a system that is under stress, and we are very concerned about where things are headed. I think people should continue to be aware that the hospitals in the city continue to work in partnership with each other, as well as our regional partners across HNHB. So we continue to very much think and act like a system. And I'm really proud of the work that hospitals across the region have been doing together. This particular variant has really been a game changer in terms of hospital operations. Like St. Joe's, we are seeing challenges both with increasing numbers of patients and staff infected by the virus. As of today, Hamilton Health Sciences has 519 staff and physicians who are self-isolating. We've also seen a sharp increase in the number of COVID patients in our hospitals. We've got 146 COVID patients at HHS today. 23 are in ICU, 2 are on ECMO, which is the most intensive form of care for a COVID patient. We have 8 outbreaks that we are managing, which is a very challenging situation to manage. Beyond this, we are operating over capacity. So if we just set COVID aside for a second, this time of year can be very challenging for hospitals, even without a pandemic, and this year is no exception. So we are seeing lots of illness in the community, quite apart from COVID, which is adding to the challenge. The result is we see very high volumes in our EDs, including an extraordinary number of patients arriving by ambulance. I wanted to acknowledge that our partners in long-term care and retirement homes are also very much under strain. And of course, this has an impact on the whole of the system, because if long-term care and retirement homes are under strain, they have a limited ability to accept patients from hospitals, so everything starts to get backed up. So as a result of all of this, we are implementing extraordinary measures, some of which have been mentioned already. We're ramping down scheduled and procedural care, pediatric and cancer care, urgent, emergent cases are all accepted. We are redeploying staff from our ambulatory and non-critical areas and redeploying them to the areas of greatest need to backfill for staff who are off self-isolating. We will be following provincial guidance around recalling staff who are isolating at home, but who are currently testing negative, but may have had some exposure. But we will be doing that in accordance with the very careful guidance published by the province. I guess I would just say, we're imploring the community to follow current public health advice. Our hospital system really needs the public, as weary as the public is, to pay attention and observe the new, stricter and more necessary measures that were brought forward by the province. We just have to curb and bend the curve on the epidemic to the pandemic to the extent that we can, to try to make sure that our healthcare system isn't overwhelmed. We'd also ask people to really be thoughtful about the choices they make when they are seeking healthcare. Reserve our emergency departments for the most critical, most acute needs. Not COVID tests or diagnosis. Your family doctor should always be your first point of contact for non-urgent medical issues. And please be patient when you do come to hospital. Our staff and physicians are doing their very best, but they are tired. And we apologize if your appointment or surgery has to be postponed, but it really is our only option at this time. Maybe I'll leave it there, just end by saying that I'm super grateful to all of our staff and physicians for all the hard work that they're putting in. We really owe them a tremendous debt of gratitude for their resilience and how dedicated and hardworking they've been throughout these past 2 years. But the fact is, they are pouring it on again. And really going over and above the call. So we're grateful to them. Unfortunately, I don't know who I'm passing it along to.
Me.
Oh, Scott, okay.
Yeah, thanks, Rob. My name's Scott Wooder. I'm the lead physician for the Hamilton Family Health Team. And I've been a physician in Hamilton for 35 years. In that time, we've had lots of challenges as a community. But I think it's fair to say we've never seen anything quite like the worldwide pandemic we're facing now. In the past, we've pulled together and overcome our challenges, and that's exactly what we'll do now to make a better, safer, and healthier community. The Omicron variant of COVID is extremely transmissible and may well overwhelm our traditional methods of assessment and treatment. So what can we as individuals do? First, and it's been said by everybody on the call, but us risk repetition by saying it again because it's so important. We have to get vaccinated. So whether it's your first, second, or booster dose, get vaccinated as soon as possible. It's the best thing you can do to protect yourself and your family, as well as the rest of the community. We need to wear masks where appropriate. And I must say how impressed I am by how widespread that culture is in Hamilton. People wear masks. I've seen in other communities, or at least news reports of other communities where people are reluctant to wear masks. We're not seeing that here. It's something we should all be proud of. We should avoid unnecessary contacts as much as possible. We should use common sense approaches to minimize risk of transmission. Even things as simple as hand washing make a big difference. But despite all those best interests or best efforts, some of us are going to get symptoms of COVID. And what should we do when we get these symptoms? For people with mild symptoms, the first thing people should consider is self-care. We've all had many, many colds and flus in our lifetimes, and we know that we can usually manage these things at home by ourselves with the help of our family. We know the importance of rest and fluids, anti-fever medications if needed, and we know we don't always need to see a nurse or a doctor when we get an infection. So there's nothing different here. We should, if possible, care for ourselves at home. Now, for further intervention or advice is needed, the best place to get information is from your usual family physician or other primary care provider. Your family physician knows you and your family. They have access to information about your health, and they're best able to give you advice that takes into account your unique circumstances. Once you call them, they may arrange for regular phone checks. We think this will normally last for between 5 and 7 days. It may take up to 14 days. We may also send you an oximeter. Now, an oximeter is a simple device that measures your oxygen levels, and it's crucial in determining who can be managed at home and who needs a urgent intervention. Now, most people won't need that level of monitoring, but it is available if necessary. If you don't have a primary care provider, or despite your best efforts, you're unable to reach your primary care provider, we're developing a system of virtual urgent or virtual primary care. We're going to publish later this week a website address and a phone number to help people get connected with this level of care. This is really the primary care community coming together to help us all look after our patients and those people who unfortunately don't have access to a regular family physician. Some people may well need in-person assessment, and those pathways are also being developed. And despite what we've said here about not going to the emergency room inappropriately and calling your family doctor, looking after yourself at home, people with true medical emergencies do need to call 911 or go to the emergency room if they're having acute symptoms or in distress. They need immediate help. Now, none of this is easy, and it's not always easy to get information. We are making a commitment to have available, reliable, easy to understand, relevant information on a regular basis. And again, we're going to publish that in the next day or two, a site where people can go and get access to information. I think Dr. Richardson also talked about the public health site where people can go. Primary care is part of a team along with hospitals, long-term care, public health, other community providers, various levels of government. But remember, the most important part of the team is and always will be you. So take responsibility for your own health. Be careful, stay informed, get vaccinated. And one piece of advice, it's a final piece, everyone's trying their best. And you've heard on this call how stretched the resources are in the healthcare system. So we really appreciate everybody doing what they're doing, but be patient and generous. as you normally are, and that will help healthcare providers give you the help that you need. I'm going to pass it back to Jen Racine to moderate questions and answers.
Thanks very much, Dr. Wooder. Mr. Mayor, if you'd like to make a few remarks.
You know what? Why don't I just wrap up, because I think he said everything I was going to say. So no need to add to that. So after questions, I'll do a wrap up.
Great, thanks very much. So we have 7 media partners joining us today. First, we'll go to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much for taking my questions. This is for both Melissa and Rob. We know some hospitals in the GTA are now in a code orange and could be moving patients to other hospitals. Have any of the Hamilton hospitals received patients, and would they even be able to do so right now?
So we have not received any patients from outside of our region. I think there would be, I don't want to say we couldn't receive anybody, but I will say we have a very limited capacity at the moment to receive any additional patients, because we are straining to take care of the patients within this region. It's not, look, if a hospital is in code orange in the province, hospitals across HNHB and in Hamilton more particularly will do everything we can to help out, but we do not have a ton of extra capacity right now. So yeah, would be very limited.
Thank you. Nicole, any follow-up question?
Yes, I didn't know if Melissa from St. Joe's would be able to answer also, or if that's just for Hamilton and as a whole. Also, I did have a question for both as well about those that are coming to the hospital and needing hospitalization for COVID-19. How severe is the illness, or are you seeing people coming in with a sore throat, requesting care or testing? If you could just give us a bit more of a description of what it's looking like within your hospital walls right now.
Yeah, that's great. I did just want to say that I fully support what Rob said, and he was really speaking for Hamilton as the collective. I mean, I think the only point that I would just say is that we have been working very closely with our regional partners in Hamilton, Niagara, Haldeman, Brant, and the Burlington region. And we actually have a regional model of care where we really, are actively reaching out to each other. So we are really fortunate, I think, to have such an excellent model here. But equally concerned as Rob is about our ability to actually take in additional transfers from outside of the region at this point in time. In terms of what we're seeing in the hospital, I would say to you that we are still seeing severe illness, as you can appreciate. Certainly those that are in ICU require the ICU care. We are seeing that we are largely admitting onto the ward. And I don't know, Rob, if you wanted to comment on that too. So this is, if you think of what we went through in wave 3, it was largely to ICU. In this circumstance, we're back to largely to the ward. But again, we're looking at this on an active basis. We're monitoring this, concerned about the growth that we're seeing in terms of the cases that are coming in. And we wouldn't be admitting someone who didn't require the hospital level care. So we're talking about individuals that are sick. Rob,
yeah,
do you want to comment?
No, I think Melissa's entirely accurate in what she says. I think we're, the qualitative difference that we're seeing in this wave is a lot where in many instances we are admitting patients with COVID as opposed to for COVID, although for sure both are continue to happen. So look, I'm not a physician, and Dr. Wooder or Dr. Richardson probably better to answer exactly the nature of this variant and its impacts on health. But I can tell you in terms of that hospital experience, it is a much different experience this wave, because the pressure is predominantly in the wards as opposed to the ICU. Now, given how quickly the numbers are rising, we're all worried about the ICU as well. And so if those numbers continue to rise, I think all parts of the hospital will feel that strain.
Thanks very much, Nicole. Next question goes to Bobby Rostova from CBC Hamilton. Bobby, you can go ahead.
Thank you. Happy New Year, everyone. I hope you all had some time to catch your breath for a brief moment. My question for Mr. MacIsaac and Ms. Farrell, what are we doing to try to fill in that gap of all the healthcare workers in self-isolation? How are we trying to manage that?
Well, I'm happy to start, and I'm sure Melissa can supplement my answer. But the most immediate response is to look at this ramp down of services combined with a redeployment of persons from their usual home areas to areas which are in need of further people. So the ramp down and redeployment is sort of the primary strategy. I think as we move deeper into this, we'll have to consider other strategies like being more aggressive about bringing people into work who are self-isolating. Of course, we'll try to do that always in accordance with the provincial guidance from the CMOH. But I think, again, as time goes on, we may have to resort to further measures like calling out to the community for further help from retired healthcare workers and so on. We're not doing that today, but I think that would be sort of an arrow in our quiver if we had to get to that.
And I would just say we're doing the exact same thing at St. Joe's.
Thanks, Bobby. Any follow-up question?
Yes, I do have a follow-up question. Thank you both for that answer. Dr. Richardson, I know that you mentioned a walk-in clinic for people age 50 and older at the center on Barton. Is there any potential for more walk-in clinics for other age groups? Because it does seem like the demand for boosters has slowed down a little bit.
Hi, Bobby. Happy New Year. And when it comes to the approach with the vaccination clinics, we're very much monitoring day by day what we're able to do and continuously improving the clinics to get as much throughput as we possibly can, but at the same time monitoring to see what the uptake is through the booked route. And as you heard today, when we're seeing that it does seem to be a bit of slowing in demand, we're not sure yet whether that's just this everybody trying to get in line with the transition that's been happening from holidays to dealing with things in their personal lives, or whether this represents as well the fact that some people who are sick and so not booking in until they're able to be sure that they're not coming into our clinic sick, which is a great thing that people are doing as well. So we are trying to manage as much supply as we have to try and get it out there as quickly as possible. So starting with those who are at highest risk of severe illness, so those that are over 50, that's our first target group. They're the people that we know are longest from their previous doses and are at highest risk overall in terms of severe disease. So that helps them. That also helps our health system as we go forward. We'll continue to look at ways we can expand reach. We do have those long-term care homes, the seniors congregate settings that we really do want to get out to. Again, higher risk settings where people can be at higher risk of disease and can make a bigger difference in terms of what we're seeing as we go forward. And then we'll look at whether we open up more clinics in that way and whether we open it up to additional age groups. So very much an active day-by-day discussion amongst all the partners that you see here about how we can best move forward and get vaccine to arms as soon as we possibly can.
Thank you.
Thank you, Bobby. Next question goes to Justin Chandler from TVO. Justin, you can go ahead.
Hi there, thanks for taking my question. So I'm wondering for Dr. Richardson, you'd mentioned that hospitalizations have become a more key indicator now that testing has been so restricted. And I'm wondering if the way that public health shares and presents COVID-19 data with the public is going to change to reflect that.
Thanks, Justin. When you look at our dashboard that we use, a Power BI tool to report those things, hospitalizations, ICU numbers, those have been something that we've been following for some time. We will look at our public reporting, make sure that that's represented there and that people are able to follow it along. I think we'll certainly continue to use it when it comes to any media briefings and questions that we answer routinely with the media as well. So very much a critical part of this. And I would say as well, our outbreak numbers are a big part of that as well. When you see just the number of settings where we're seeing outbreaks, the number of settings that are affected, the effects that has on those places, on our overall health human resources, those are important pieces to be following as well. We'll also continue to report the percent positivity of the tests that are being done. That's another indicator that can help us understand what is happening in the community. So yes, we'll continue to look at how we can make those numbers available.
Thank you. And Justin, any follow-up?
Yes, I've got one more for Dr. Richardson. I know that as of late, a lot more people have been talking about COVID-19 detection in wastewater as a potential way to get a more accurate look at cases. And I know that there's been a lot of research into that going on in Hamilton for a while now. I'm wondering if that's something that public health is looking at, and if so, how?
Yeah, the piece about COVID testing in wastewater here in Hamilton is we've seen a different pattern when it comes to its positivity trends here, and so we definitely have seen in other systems that in Ottawa and other places where it has been very successful in terms of looking at overall Omicron data or COVID data, but it hasn't been as useful here in Hamilton. We're betting that's something to do with our system, the way it's set up overall when it comes to our wastewater management, but it hasn't been as useful here in Hamilton. So we do stick to the other indicators for monitoring here.
Thank you, Justin. Next question goes to Desmond Brown from CBC Hamilton. Desmond, you can go ahead.
Thank you. A question for Dr. Richardson and anyone else who wished to chime in. What's your reaction to the decision yesterday to delay the return to in-person classes? And what will you be looking for among the student population now that they're back in remote learning?
I think that was for Dr. Richardson.
I think she's frozen.
Yes. I think she's frozen.
Yes, I think
Melissa,
she is.
Why don't you take that one? So there is some consternation around that whole process province-wide. And I think the GTHA mayors actually got together today and certainly encouraged the province to get kids back to school after this 2-week period, as best as possible, so that they can, continue to learn and continue to not have to deal with the mental health issues and all the other parameters around having kids out of school, including, with parents and daycare and all the other challenges that come with it. So I think there's a belief there's always been a belief to have the schools be the last to close and the first to open up. And certainly that's certainly a philosophy that we want to encourage the province to continue to adhere to. I see Dr. Elizabeth is back, so I'll let her, if you heard it, take it from here. All right,
Sorry.
maybe you fire your question again.
Yeah, please, Desmond, if you would. My apologies, my internet just cut out entirely.
Sorry about that. So the question, your reaction to the decision to delay the return to in-person classes, and what will you be looking for among the student population now that they're back in remote learning?
Thanks very much, Desmond. When it comes to our education system and particularly our children, we're, very much behind the sentiment that last to close and first to reopen. We know that throughout this stage of the pandemic, we're very much looking at balancing risks between the risk of transmission in the classroom and in education and workplace settings, and the risks to our children in terms of their mental health and well-being, as well the support that schools provide overall when it comes to educating our children and the time that it takes for parents need to be home, looking at supporting their kids in education of education that can go on as we go through that process. So it's very much a balancing act. We appreciate the decision that's been made at present. We've been very pleased to see the changes that have come about, whether it's HEPA filters or improved ventilation overall in education, the many, many moves that have been put in place to ensure that those sites are as safe as they possibly can be. You know, everywhere in the community right now, there is significant transmission of Omicron going on. I know Ottawa did a nice piece of analysis looking at the risk of transmission that they have seen when kids are in the community versus in the classroom, and seeing that the transmission was actually lower when kids were in the classroom. We saw that in part with the Delta wave as well. So I think there's a number of concerns, a number of issues that we're hearing, you know, from teachers, from educators overall, from parents, and those need to be looked at, addressed, and look at ways that we can absolutely get our kids back in school as soon as we can.
And Desmond, any follow-up question?
Yes, thank you. Dr. Richardson, is there any update on getting more rapid tests in Hamilton, and any plans to get those to vulnerable populations?
Yeah, thanks, Desmond. Certainly the availability of rapid tests has been a major issue over the last many weeks. Now we're heading into many weeks of this being the case. And right now those are being focused as much as possible on keeping our health system running, on keeping people at work in terms of self-isolation, whether it's keeping people in terms of coming back and working isolation, I should say, or whether it's you know, keeping people able to stay at work as we go forward through this. So there's certainly a shortage. We do want to see an increased access to those, and the province is very much working on that. We're hearing in the next couple of weeks that might be possible. We're very aware of the fact that vulnerable populations have not had as great an access to this. We were just actually speaking about this today with our fellow medical officers, and how can we look at testing strategies for those that fit into that group. And so we are, that's very much an active area of discussion as the availability expands.
Thanks very much, Desmond. Next question goes to Matt Van Dongen from the Hamilton Spectator. Matt, you can go ahead.
Hello, thanks folks. I'm going to direct my question to Jason Thorne. And forgive me if you already mentioned this, Jason, but with the new restrictions coming back into play, does that change how many people can get on one of our HSR buses, for example? Or are we thinking of making any changes in terms of capacity for our buses?
So we've not made any, thanks for the question, Matthew. We've not made any changes in terms of capacity on our buses. For the most part, we are still seeing fairly reduced ridership levels across all of our routes. So we haven't seen any significant crowding issues or capacity issues on any of the buses. So we aren't looking to do any reduced capacities. We are continuing to monitor staffing levels. HSR is one area where we have seen some increase over the past day or two with respect to absenteeism. And I do anticipate, so far we've been able to maintain our regular schedules, but I do anticipate that in the weeks to come, we are going to have to look at some schedule adjustments to deal with some of the staff absenteeism. The approach we'd be taking is similar to what we did back in the fall, where we'd be looking at adopting modified schedules so that we still have a predictable and reliable schedule that the public can be aware of and can plan their trips around. So as I said, at the moment, we're maintaining our regular schedules, but I do anticipate that will change in the coming weeks.
Thanks very much.
Any follow-up question, Matt?
He actually just addressed my follow-up, so we're all good.
Great, thanks very much. Next question goes to Joanna Furketich from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions, and Happy New Year, everyone. My first question is for Dr. Richardson. Dr. Richardson, local public health departments have always been able to put in restrictions above what the province has in place. Can you talk about why you decided not to put in extra restrictions either before Christmas or before New Year's? You know, we've been seeing cases, you know, increasing rapidly in Hamilton. Can you talk about the decision not to do that?
Hi, Joanna. Happy New Year. Yeah, thanks very much for that. As we've gone through this pandemic throughout, we look at what additional restrictions could be put in place that relate to what's happening locally, and continue to have that dialogue across the province with Kieran Moore, of course, and with our colleagues that in public health from all across Ontario. And so very much where there's something that's happening that's uniquely local, we talk those things through and look at what else might be needed. And you've seen us do that from time to time. At other times, really the situation is the same across the province. And so very much pushed for consistency in measures that are happening across Ontario. Otherwise, we do see, as we did see it at certain stages early on in the pandemic, where you end up having pressure that moves from one health unit to another health unit, depending on what the rules are in a given area. So we've been watching the numbers closely as we go forward, speaking regularly with Dr. Moore and our colleagues in the Office of the Chief Medical Officer of Health, and looking at what measures are needed. And so been very glad to see us move provincially as a whole just before the winter holidays, and then move further as those hospitalization numbers rose, as the ICU numbers rose. That was very concerning for all, and looking at the need for quick enactment of new measures as those numbers came up in order to blunt the wave. We know overall this wave is not going to be slowed down or stopped in any sort of way, but it is blunting it so we can move forward, preserve our hospital capacity as much as we possibly can, and make it through these next several weeks and into the next couple of months.
Thanks so much for that. My next question is for Rob and Melissa. Can you talk about how close your hospitals are to being overwhelmed? Like, do you have modeling that would suggest for you when that might be coming, or if that is coming? Like, is there a number of COVID patients that is sort of the number, similar to what they have for the province, that is, the number that, significant trouble here in Hamilton? Like, can you give us an idea of where you're at and what you're facing and what your measures are to measure that?
I don't know that I can give you a lot more than what I've already said, Joanna. I think that the system is definitely under strain. We have very limited capacity left to take on significant new numbers of patients. We're currently operating over capacity. I think across the whole of the city. Now, it's a very dynamic situation running a hospital. So day in and day out, there's always people coming and people going. So very difficult to say, we can take X number more, because it all depends on who's leaving today and who else has shown up in the ED. But I think in broad terms, what the best way to say it is what I have said is, the system is under strain. There is not a lot of capacity beyond where we currently are. I think as additional people show up and more calls are made on the system, it will increasingly strain our ability to deliver quality care to the patients who arrive. And so the staffing ratios to patients and so on will continue to deteriorate. So, we're very concerned by where we are today and the outlook. And that's why we're really imploring people to do all that they can to respect the public health measures which are being promulgated.
I don't have anything really to add to that. I would just echo the comments that Rob has just made. I think that's exactly right in terms of the planning that's underway. And I think, if we're getting asked to create more ICU beds, more capacity, I don't think we have the ability to do that at this point in time. So we're really managing with the capacity that we currently have. And to Rob's point, it is fluid within the organizations, but the system is under strain, and we are deeply concerned about what lies ahead for us over the next few weeks.
Thank you, Joanna. Our final media questions go to Richard Leitner from Hamilton Community News. Richard, you can go ahead.
Thank you. Good afternoon. We had a letter from a reader in Stony Creek who was upset that I gather he and his wife are over 55, have what they say are pre-existing medical conditions. And I guess the booster shot they're being offered is the Moderna, and they received the Pfizer for their first 2 doses. So they are upset about that. And I'm wondering, just for the public's knowledge and my own, Is there any reason to feel worried about getting the Moderna if you've had the Pfizer? Is there any difference in terms of efficacy or potential side effects?
Why don't I take that one, Jen, if that's all right? I can start it off for Scott. So when it comes to the vaccines, the mRNA vaccines that are available, the Pfizer and Moderna vaccines, they are interchangeable. And so one can have one or the other and receive each one of those at each dose in terms of what is available and what might be somebody's preference in usual times. At this point, when it comes to the Pfizer vaccine, we are having to preserve our supply of that vaccine for those that are under the age of 30, because that group is at higher risk of myocarditis and pericarditis. And so we need to make sure that we have vaccine on hand to immunize that group. So we've been using Moderna, offering Moderna in our clinics for those that are over the age of 30. In fact, in the end, it looks like this is probably an advantage for people in terms of Moderna. There's some early indications that it may have slightly higher levels. It may have last slightly longer in terms of its use. So I wouldn't at all be worried about combining those vaccines, and there may even be a slight advantage as we go forward. Scott, did you want to add anything?
Well, maybe just to make it a little personal, I've had Moderna vaccine and don't feel the least bit disadvantaged. As a matter of fact, just remind everybody what a miracle it is. We developed these vaccines in less than a year, and in another year, delivered over 1 million vaccine doses in Hamilton. So we have nothing to apologize for. It's been a tremendous success story.
Richard, any follow-up?
No, I think Dr. Richardson answered the question on why you're saving the Pfizer vaccines for under 30. So that's good. Thank you very much.
Thanks very much, everyone. And with that, Mr. Mayor, I will pass things back over to you.
That's great, Jen. Thank you very much. And I'd like to once again acknowledge and thank our panel today, Jason Thorne, of course, and Dr. Richardson, but especially Melissa Farrell, president of St. Joseph's Hamilton Healthcare, and MacIsaac, president and CEO of Hamilton Health Sciences, and Dr. Scott Wooder, the lead physician with Hamilton Family Health Team. You've shared some very important information and updates today, and we sincerely appreciate your efforts as well as the efforts of the entire system that, as you can tell, is collaborative and very well organized. So very much appreciated, and certainly we appreciate sharing this information with our broader community to help them make informed decisions as they go forward. Thank you again to Bill Custers and Cable 14 and Clear Cable as well for helping us put these media advisories together. And of course, to the media partners that have asked questions, and hopefully we'll share some of those answers with their listeners and viewers. We appreciate that. That's the best way for us to get our information out there. And if you want more information on COVID-19 or for the financial supports or any of the updates that are available, visit our website at hamilton.ca/coronavirus. And please remember to shop local and order from your local restaurants directly as much as possible. If you can order directly and pick up, even better, then that restaurant gets to keep all of that order and money. The delivery costs are actually added burdens for them. So if you can go direct and help your local restaurateurs, and the hospitality industry right now, particularly hard hit, I'm sure they will appreciate it. And certainly you'll also benefit from getting some great food from all those great providers. And also a reminder to support your health by taking advantage of some of our local outdoor amenities and activities if you're able. So all of our trails, our parks, our park trails are open and are going to remain functional. And so if you can get out, probably good for your health and well-being to get out as much as you can. Enjoy the fresh air and the brisk air if necessary, but certainly do what you can to stay healthy and exercised. For the latest information on the city's website, go to hamilton.ca/coronavirus or follow us on social media. And for all of us today, thank you for all the participants, and thank you for signing in and joining in. And we will see you back here on Monday, January the 10th at 3 p.m. for our next COVID-19 briefing. In the meantime, look after one another and be kind to one another. and turn whatever anxiety or anger you have into some positive activities, some of which were outlined today. The masking, getting vaccinated, all of those are going to make a huge difference in terms of how we curb this virus. So thank you for tuning in, and we'll see you next Monday, January the 10th.